Welcome to Zeal Nutri channel. Today we will discuss what is PCOS, causes, symptoms, and diagnosis. Before starting to this video, subscribe to my channel and hit the bell icon. PCOS or polycystic ovary syndrome is a hormonal condition that occurs during childbearing years, usually ages 15 to 44, among females. Essentially it means that cysts, partially formed follicles, grow on the female ovaries, which contain eggs. In polycystic ovarian syndrome, fluid-filled cysts develop on the ovaries. If an ultrasound is done, numerous immature ova can be spotted, which are mistakenly referred to as cysts, and the ovaries appear enlarged. Causes: the follicles contain immature eggs, and they never mature enough to trigger ovulation. The lack of ovulation alters levels of female hormones like estrogen, progesterone, follicle-stimulating hormone FSH, luteinizing hormone LH. There will be a low level of progesterone, while androgen levels are higher than usual. Commonly, people with PCOS have high levels of insulin that may not work effectively, and male hormones known as androgens, or both. In this way, some women also experience insulin resistance. Mostly, the following factors may play a role: family history, genetics, hormones, lifestyle. Having polycystic ovaries does not necessarily mean that you have PCOS, polycystic ovary syndrome. While women with PCOS have symptoms as well as polycystic ovaries. Symptoms. Common symptoms of PCOS: irregular periods, hair growth on the face and body, acne, weight gain, heavy bleeding, male pattern baldness on the scalp, darkening of the skin, headaches. Diagnosis. A diagnosis is made when you have the following symptoms: irregular periods, no periods, or infrequent periods. An increase in facial or body hair or blood tests that show higher testosterone levels than normal. Ultrasound scan with polycystic ovaries. When a diagnosis is done, you may be referred to a gynecologist, a doctor who specializes in a woman's reproductive system, or an endocrinologist, a doctor who specializes in the hormonal system. 5 effective natural treatment remedies for PCOS. Balanced diet for PCOS. Blood sugar levels should be stabilized through a balanced diet, including whole foods, which is the key to treating PCOS naturally. Due to rapid spikes in blood sugar levels, insulin resistance syndrome can develop over time, so sugary foods should be banished. Insulin resistance syndrome is a condition in which the body is not able to control blood sugar levels and weight gain effectively. The following basic tips should be considered for the best PCOS diet. Reduced intake of saturated fats. Dairy products should be limited or avoided. Low carbohydrates should be balanced with sufficient protein. Phytoestrogens must be included in the diet. Additives, food chemicals, and preservatives must be avoided. Alcohol and caffeine must be avoided. Sugar must be avoided. 2 liters of filtered water must be consumed daily. Essential fatty acids should be included in the diet. 2. Supplements for PCOS. Many women lack important vitamins and minerals for hormonal health. When oral contraceptive pills are taken for the regulation of periods, then they may cause vitamins and minerals deficiency. The root cause of PCOS can be treated by correcting this imbalance of essential nutrients. Inositol. Inositol is a B vitamin that can improve insulin resistance and fertility in some cases of PCOS. Chromium. Chromium supplements help to improve your body mass index, which can help with PCOS. They can also stabilize insulin resistance by helping your body metabolize sugar. Cinnamon extract. It comes from the bark of cinnamon trees. Cinnamon has been shown to have positive effects on insulin resistance. Cinnamon may also regulate menstruation for women with PCOS. Turmeric. Curcumin is the active ingredient in turmeric. Turmeric may decrease insulin resistance and act as an anti-inflammatory agent. Zinc. As a trace element, zinc can boost fertility and immunity. Excessive or unwanted hair growth and alopecia may be improved by using zinc supplements. We can get it from our diet also by eating red meat, beans, tree nuts, and seafood. Evening primrose oil. Evening primrose oil has been used in period pain and irregularly improves cholesterol levels and oxidative stress. Vitamin D and calcium. Vitamin D is a vital hormone for your endocrine system. Vitamin D deficiency is common in women with PCOS, therefore vitamin D and calcium supplements may improve irregular periods and help you ovulate. Cod liver oil. Cod liver oil contains high amounts of omega-3 fatty acids with vitamins D and A and help get rid of fat around your waist. Supplements are also used with the following ingredients: amino acids N-acetylcysteine, NAC, and L-arginine. Coenzyme Q10. Diindolylmethane DIM. Essential minerals. Essential vitamins. 3. Herbs for PCOS. PCOS can be effectively treated with herbs. The following herbs should be considered. Berberine. Berberine herb is used in Chinese medicine to help with insulin resistance. Chasteberry, Vitex onus castus. The pituitary gland function is stimulated and normalized by this herb to help treat infertility and PCOS. Peony and licorice. The combination of licorice root, Glycyrrhiza glabra, and white peony, Peonia lactiflora, can help regulate hormones like estrogen and prolactin, improves LH to FSH ratio, and reduces elevated levels of androgens like testosterone. Maca is an herb that can help cure PCOS symptoms like acne, hirsutism, irregular menstrual cycles, and even insulin resistance. Gymnema is an herb that can help reduce sugar and carb cravings. Tribulus is an herb that helps restore menstrual regularity and regulate ovulation. Blue cohosh is an herb that acts as an ovarian and uterine tonic and pelvic anti-inflammatory. Holy basil. Holy basil, also called tulsi, is referred to as the queen of herbs. It can help reduce your blood sugar, prevent weight gain, and lower your cortisol levels. Ashwagandha. Ashwagandha is also known as Indian ginseng, which helps balance cortisol levels to improve stress and symptoms of PCOS. 4. Other PCOS treatments. Congestion can be reduced with the help of lymphatic drainage. Acupuncture can also be used to treat PCOS. Some acupuncture points are used for breaking up stagnation, stopping pain, and moving blood. 5. Exercise for PCOS. Fitness is very necessary for women suffering from PCOS. Some exercises that can help with PCOS symptoms include aerobics, cycling, Pilates, power walking, and swimming.